Welcome to the Pivot Clean Energy Podcast, How the World Cooks, the energy shift you need to know about. I'm your host, Alicia El-Mamouni. On this podcast, we are going to explore everything cooking and how it impacts the world, the stoves and fuel people use, access and availability to clean technologies, and more. Join us for personal conversations with individuals in the sector to learn about the dynamics that influence the way people cook around the globe. With over a third of the world's population still cooking with solid and polluting fuels like wood, charcoal, and kerosene, there are huge global impacts on health, climate, the environment, and gender and social considerations. But that's not the whole story. Come along with us to discover how the world cooks and why you should care. Dr. Megan Benka-Coker is an assistant professor in the Health Sciences Department at Gettysburg College. She has a depth of background and training in global health and environmental epidemiology, and you're going to hear just what that means in a few minutes. As a professor, she's teaching her students about the important topics surrounding public and global health, and she's also a researcher focused on addressing the health impacts of household air pollution and the benefits of transitioning to cleaner cook stoves. We have the chance to step into her classroom today and hear firsthand what initiated her interest in epidemiology, some of her personal and research experiences that allowed her to research clean cooking around the globe. We're also going to hear about particulate matter and why ambient and household air pollution is such a big deal and has such dire health impacts around the world. We also get a chance to talk about how research can shape policy and why it matters to include health in the global clean cooking conversation. Dr. Megan Benka-Coker, so happy to have you on the show, How the World Cooks, today.
Thanks for having me, Alicia. I'm so excited to be here.
Now, when people think about how the world cooks and cooking styles, health probably isn't the first thing that comes to mind. And today we are going to focus our episode on health, and you're going to help us understand where that connection is between health and cooking practices around the world. But before we jump into all that, I want to talk a little bit about you and how you got interested in the field of epidemiology, because I don't think most little kids wake up and say, oh, I want to study global health and epidemiology when I get older. So what was your first exposure to that concept and what got you interested in it?
Yeah, I think that's a great question and definitely not something I ever envisioned doing as a small child. So my first introduction to public health and epidemiology happened when I studied abroad in college, actually, in Uganda for a semester in 2007. The program that I was on focused actually on international development, but a lot of the conversations that we had with faculty members from the university or different experts in the field were actually talking about health. And it was then that I realized that public health was something that I could pursue as a career and something that I was really interested in. And so from there, I decided to pursue a master's degree in public health with a focus on global health. And so epidemiology really focuses on looking at the determinants of disease and the occurrence and distribution within a population. And so it's the backbone of public health and the methods really that are required to conduct scientific research. And so that's how I sort of got my introduction into public health.
Okay, great. I think that was really helpful just to explain even what epidemiology is, because it's not a word you hear every day. And so you had that first exposure traveling abroad, studying abroad in Uganda.
Yeah.
And that started your interest in global health. What was your first exposure to the concept of clean cooking and how that ties in to global health?
Yeah, that came a little bit later. I think while I was abroad in Uganda, I saw people cooking on different types of fuels without electricity. And I actually did a homestay with a family in Uganda who cooked some of their meals on open fires. But it wasn't really until graduating from college that I first started thinking about household energy and cook stove. So when I graduated from college, I pursued an internship with Project Gaia in Ethiopia. And actually, my main motivation for doing this was to gain experience working with displaced populations. That's something that I pursued while I was in Uganda, thinking about how refugee populations have access to energy. And so Project Gaia and their Ethiopian counterpart, Gaia Association, were working in several refugee camps in Eastern Ethiopia. And so when I pursued this internship with them, I was given the opportunity to go to Ethiopia for, I think, 3 months as an intern and help with some of their
Mm.
projects. And it was really on this trip that, of course, I was introduced to cooking as a topic, and being able to see this firsthand in some of the refugee camps in Eastern Ethiopia was really eye-opening to me.
Mm.
And I saw both the bioethanol cook stoves and the traditional cook stoves firsthand, and realized, that there was this benefit to switching to something cleaner, really for families, for women and the children that we worked with. It was very clear that this was bringing something beneficial to their life.
Mhm.
And then I followed up on that, actually, during my master's of public health. So I went directly after Ethiopia to pursue my master's of public health, and I was really determined to go back to Ethiopia. I had such an amazing experience there with the people with the project, and I returned the following summer during my MPH to conduct like a mini project. At that time, the refugee camps did not have access to fuel. There was a fuel shortage going on, but I worked within the capital of Addis Ababa, with women cooking with firewood, to start monitoring their levels of exposure, and asking them questions about their knowledge and their attitudes and perceptions of household air pollution, and sort of what they
Mhm.
thought about cooking.
Interesting. So you graduated, you had this transformative experience in Ethiopia with Project Gaia. And can you just quickly describe who Project Gaia is for those who
Sure.
might not?
Yeah, Project Gaia is a nonprofit organization, and they're based out of the town actually where I went to college, so that's how the connection was made for me.
Okay.
Um, and Gaia Association is their partner in Ethiopia, working on clean energy, primarily bioethanol fuels.
Okay, super. So you went, you did this, you had this experience where you were interacting with people, talking about cooking and their perspective on it, and probably opened up a whole new picture of, their view versus how we view cooking, and whether they're even aware that cooking with wood or charcoal can be harmful. Did you experience that at all? What was the feedback you got from those women that you were working with?
Yeah, I think they know, and they knew very clearly that, cooking with firewood or charcoal, especially doing so indoors,
Mhm.
cause, eye irritation. They often talked about headaches, or their children, having significant colds all the time from exposure to cooking.
Mm.
So they were certainly aware of it. I don't know that, at the forefront of their mind, health was a primary concern. I think they noticed symptoms, but maybe didn't think about the potentially large impacts of on health with cooking. Um, but other reasons came to mind, that they would want to switch to something better, such as time savings, was
Sure.
always a big component of that conversation.
Yep. Okay, so we're going to get into the details of
Yeah.
that in a little bit. What happened after that second trip to Ethiopia?
Yeah. So I kind of took a little divergent path. So when I graduated from my master's of public health, I wasn't finding this job that I really wanted, which I'm not sure existed. Working in global health and doing really awesome things. So I decided to gain experience, furthering my research skills, and sort of gain these skills that could help me on different projects. And so I ended up working for 3 years in Atlanta as a research coordinator on this large multi-state program focusing actually on preventing childhood neglect. And
Mm.
we were teaching parents and caregivers how to interact with their young children and what skills they could use, to prevent childhood neglect and abuse. And so it was by working at this job that I kind of quickly realized that the topic itself was not my area of interest. And over the 3 years, just really found myself longing to go back and work on cook stoves and household air pollution. And it was those field experiences that I had in Ethiopia that were so powerful and
Mm.
impactful, that drove me to want to go back and work on cooking. And so I decided after 3 years that the best way to sort of get back into this field was to pursue a PhD in environmental health and epidemiology. And my thought was that this would give me the tools and expertise to then collaborate and conduct research studies on household air pollution.
Hmm.
So I pursued my degree at Colorado State University under the direction of Dr. Maggie Clark and Dr. Jennifer Peel. And my main reason really for choosing this program was because of the cook stove projects that had been happening at Colorado State. And Dr. Clark was about to initiate a 3-year randomized trial funded by the National Institutes of Health of a cook stove intervention in Honduras.
Okay.
And I knew that by pursuing this degree, I would gain critical skills in research, but also gain field experience, which is what I really wanted. And so
Yeah.
I spent 4 months of that PhD program and sort of a few smaller trips working on this project in Honduras, which included, visiting households and participants, monitoring air pollution. And then ultimately, after graduating, at the same time I was graduating, there was a job opening up at my alma mater at Gettysburg College with
Okay.
a specific focus on public health, which was not
Wow.
something that had been here when I was a student. So I really just love the idea of coming back to my alma mater, teaching undergraduates about public health and continuously researching, my agenda on household air pollution.
Hmm. Yeah, the stars really aligned for you in that whole
Yeah.
process, even with that 3-year research break and then coming back to school. And that's really incredible that you are now in the place where you are today, which is an assistant professor at Gettysburg College. And so, can you just give us a quick glimpse of what your class involves today?
Yeah. So it's definitely not something that especially as an undergraduate, that I thought I would be doing. But it's great. I teach at a primarily undergraduate institution, so all of our students, really most of them at Gettysburg College, are young. They're between the ages of 18 and 22, and so teaching young students is great because one of our main objectives for undergrads is really just to introduce them to new ideas, new concepts. And so I teach a couple of different courses. There's another faculty member in our department also teaching some of these public health courses. We teach an introduction to public health for first year students. And then I also teach an upper level advanced global health course, an epidemiological methods course. And this semester, I've finally developed a new class on air pollution and health.
Okay, super. And we are going to be able to sit in your classroom today
Yeah.
and learn a little bit about the health impacts of household air pollution. And so I want to get into that. We're all familiar with pollution, right? We know that it's bad for us. We know it's constantly around us. We try to do things to alleviate it. But in the US or in other developed countries, we really don't have the type of pollution that a lot of the world experiences from cooking practices or other household energy. And so, can you just talk about the type of pollution that happens when you cook with wood or charcoal?
Sure. Yeah. So we don't experience this as much or as often in the US. And so primarily we think about different pollutants, and you'll hear this talked about in government and from researchers and policymakers. We discuss pollutants such as carbon monoxide, nitrogen dioxide, sometimes volatile organic compounds. And then some of the big ones also include particulate matter and a subset of that of black carbon. And so we tend to focus these actually, some of these are regulated in ambient air pollution in the US and globally as well. And the standards that we set on some of these pollutants are actually based on scientific evidence for health impacts. And so, for example, carbon monoxide is a colorless and odorless gas emitted from combustion. And in the US, a lot of us have carbon monoxide
Mhm.
monitors in our homes to alert us if the level goes to an unhealthy amount. We'll have an
Mhm.
alarm that goes off. Um, Particulate matter, I think, is the one that we tend to focus on the most and is the most widely heard of in terms of regulation and the health impacts. So, particulate matter are particles that are generated from different types of combustion, but also from burning of firewood and charcoal. And we classify these particles based on their size and their mass. So generally, these particles we're thinking about are really quite small, and we label them based on size. So you might hear someone talk about particulate matter less than 10 microns or less than 2.5 microns, less
Hmm.
than one. And so we refer to these as PM10, PM2.5, PM1, and it's all based on the size of the particle.
Okay.
And so to put this maybe into context, right, if we think of the width of a human hair, it's about 50 to 70 micrometers. So that's roughly 30 times larger than the size of a PM2.5 particle.
Wow.
So they're pretty small.
So basically,
Um,
you can't see them. I mean, they're tiny.
yeah, so PM2.5 and PM1 we definitely can't see. And the thing about these particles is that they're also composed of lots of different types of materials, so they're not homogeneous at all, depends on what was being burned. So they can also have any number of metals or chemicals attached to them that could
Mhm.
also cause potential health effects.
Okay. So when you talk about ambient air pollution, just so that everybody's clear,
Yeah.
that's the outdoor air. It's caused by, industry or vehicles or things like that, correct?
Yes. So that's most ambient air pollution is what we refer to typically as outdoor air pollution, and it's mostly caused by industry, factories, vehicles, uh, things like that.
Okay. So we're constantly bombarded by these little particles that we really can't get away from them, because they're surrounding our environment. It's just a byproduct of our lives. And they're very, very tiny and we can inhale them. Can you describe? So there's the ambient air pollution, and then in many parts of the world, cooking is happening with wood and charcoal that's also producing these very small PM 2.5 particles.
Mhm.
And first of all, where does this happen? What parts of the world is this most common in? And then can you just describe a little bit about the cooking environment that it happens in as well?
Sure. Yeah. So most of the cooking with biomass fuels, firewood or charcoal, is occurring in low and middle income countries across the globe, especially in places where electricity is maybe not readily available or it's not
Mhm.
affordable to people.
Sure.
Um, so, for example, in sub-Saharan Africa, across the whole continent, right, more than 70% of the population is still relying on biomass fuels for cooking. And so um, this also tends to happen more often in rural areas. And I think,
Hmm.
according to the WHO, the World Health Organization, in 2020, about 14% of people across the world in urban areas were using polluting fuels and technologies, compared with about 52% of people in rural areas.
Mm.
So it's definitely a larger concern in rural areas, but we still see people across urban areas cooking with polluting fuels. And then, the cooking environment really depends on where you are
Hmm.
and the lifestyle that you have, the foods that you're cooking. And so climate also plays quite a big role. So, for example, in Honduras, where I did my research, we were up in the really rural mountains. It was cold and rainy for a lot of the time, and
Hmm.
actually all of those families were cooking indoors with firewood,
Sure. Hard
because
to cook when it's raining outside and you have an open
exactly.
fire.
Exactly. So they were cooking indoors. But in lots of other places, in many other countries where it's warmer and drier, people might be using these fuels outside.
Hmm.
So firewood or charcoal are being used outside just to help ventilate all of the smoke that's produced from those fuels.
Hmm. Yeah, so when you've got the ambient air pollution that everybody is exposed to, and then you also have countries where there's more concentrated air pollution from wood and charcoal, I would assume it has a compounding effect.
Yeah, and I think that's why it's a very important reason not to forget about the impact of biomass use in urban areas, especially charcoal, where that's very common, is
Mhm.
because those populations are actually contributing to ambient air pollution. So if they're cooking outdoors with charcoal or firewood in a big city, they're contributing to all of the other outdoor air pollution that, it doesn't just stick by their house, right? It goes by to their
Mhm.
neighbor's house, it goes across the city. Um, and then those individuals themselves maybe they're cooking outdoors, but they are also exposed to um, air pollution from traffic and from
Sure.
other industries. So they're also, quite susceptible, even though they're in an urban environment.
Yeah. And so when we're exposed to these particles, what are some of those health impacts? Like, how much do they impact our daily lives, or how much do they impact health outcomes in the future?
Yeah, that's a great question. I think we tend to think about the health impacts as being primarily respiratory or primarily cardiovascular.
Hmm.
So across the globe, every year, we estimate that about 3 million deaths are occurring just from household air pollution, not
Wow.
from outdoor air pollution, but just from this cooking with polluting fuels.
Wow.
And yeah, it's a lot, and it's kind of hard to even grasp that number actually. And the respiratory disease, I think, is a little bit makes a little bit more intuitive sense in terms of if I'm
Sure.
breathing in something that's polluting, it makes sense that it's going to cause some sort of respiratory impact. We typically see among adults chronic obstructive pulmonary disease. We It's linked to lung cancer, as well as lower respiratory infections and pneumonia among children.
Hmm.
And then for the cardiovascular side, we see deaths. About 32% of those 3 million deaths are actually from ischemic heart disease, and
Hmm.
another 23% are from stroke. So it's not just respiratory,
Wow.
it's also long term exposure to air pollution causes these chronic diseases such as ischemic heart disease.
Hmm. And that's interesting because you might have a situation where somebody dies from a stroke, but there's not that connection immediately of, oh, it was probably because they were cooking over an open fire for most of their life. Um, but it does have ramifications in addition to just the respiratory diseases.
Yeah, and I think it's often, cardiovascular disease and stroke are thought of as often like lifestyle diseases and,
Sure.
based on the diet that we have. But, these deaths are separated from, attempt to be separated from those other factors. So they
Hmm.
are from this chronic exposure to air pollution, and it's hard to quantify those sometimes and wrap your mind around it. But yeah, this is independent of all these other lifestyle factors. Is cooking.
Wow. So, for our listeners' sake, can you just help us understand why that causes things like ischemic heart disease and stroke and respiratory disease? If you can just pretend we're a little particle of PM 2.5 and take us through the body once it's inhaled, what's the pathway for that particle and why does it have so many damaging impacts?
Yeah, I think that is a really helpful thing to consider, right? How do we get from inhaling the particles to, 10 years down the road, cardiovascular disease? I
Hmm.
mean, this is something that I'm just going over with my class now. So I think it's
Perfect.
great that you're asking. Yeah, so I'll keep it pretty simple, but the idea is that there are a couple of different pathways from inhaling a particle or particles over time and the health outcomes. So I mentioned earlier that the PM 2.5, for example, or particulates, right, are based on size. And so the larger particles, PM10, for example, when we breathe them in, our bodies are actually really well equipped to sort of manage and handle foreign objects, which would be a particle.
Mhm.
Um, as you breathe that in, these large particles get deposited in your upper airways, let's say your nose or your throat. And our physiological response then is to sneeze or cough or have like a runny nose. And that's our body's way of getting rid of those particles.
Mhm.
Um, so I think in the US, it's common, right, in the spring to have really heavy pollen days. And so pollen, we can see those particles. They're
Sure.
big and green and, coat all of our cars. And so those particles, our response to them are upper respiratory, our runny nose and sneezing and
Yep,
allergies.
allergies. Yeah.
Yeah. But the particles that are emitted from combustion because of, the combustion process and the heat and force, they're much smaller. And so these particles, they can enter further into our respiratory system. They can cause airway inflammation. They can lead to airway remodeling, reduce lung function, and ultimately causing inflammation. So for cardiovascular disease, it's a little bit more complicated and a little bit less clear in terms, I think, for the general audience of how this happens. So I'll sort of touch on three different pathways from the way that particles can be inhaled and inflict health damage. So the first pathway is through lung inflammation and something that we call oxidative stress. The second is through direct particle translocation, and the third is through autonomic dysfunction. So for the first example, when we breathe in those small particles, they're traveling into our lungs and they go all the way down through the bronchioles, the small branches of our airway systems, and into the alveoli. These are like the air sacs at the end of our lungs.
Okay.
And in those alveoli, we have some defense mechanisms. We have alveolar macrophages, which are these organisms that basically go in and bombard the particles. They sort of eat them up and they take care of them for us. They're like our defense mechanisms.
Mm-hmm.
So they do a great job, but when we start to be exposed to too many particles, these macrophages kind of get stressed out and they start releasing cytokines, which are pro-inflammatory cytokines, which cause the body to enter into systemic inflammation and be very stressed out, which causes tissue damage, which is related to higher incidence of cardiovascular disease. Okay, so that was the first pathway that we get from inhaling particles through the respiratory system that cause systemic inflammation. The second pathway that we can think about is actually how these inhaled PM particles go directly into the bloodstream. So they will be inhaled through the respiratory system and travel all the way down to those alveoli. And from there, they move directly into your blood system. And so these PM particles, when they move into your bloodstream, have been shown to be associated with atherosclerosis, which is the hardening of our arteries. And when this happens, it causes increased stress on the heart muscle. Particulate matter has also been shown to increase something called fibrinogen, which causes the blood to become thicker. And this increases the risk of a thrombosis or a blood clot. And so I think we all have heard of, blood clots throughout our lifetime, and especially they increase as we get older. So these blood clots that are caused by PM force the heart to work harder, and they also can become displaced or dislodged. And when they do that, they have the potential to cause heart attacks if they go to the heart, and strokes if they go to the brain. So the third and maybe less common pathway, I think, is how particulate matter can cause something called autonomic dysfunction or decreased heart rate variability. So when we change our heart rate, this can lead to arrhythmia or heart attack. And so those are the three sort of primary pathways from inhaled particulate matter to cardiovascular disease. But I'll also say that this field is widely growing, and this is something that researchers across the spectrum are looking at, from studies in mice to studies in human. It's something that the research community is really interested in. And there are other outcomes that are being studied as well. So the brain is something that's being studied more and more with its association to air pollution. So there have been studies that have actually found that particulate matter can pass directly into the brain from being inhaled. So they've found particles, diesel particles, actually in the brains of mice and in the brains of humans. And so there are a lot of studies exploring possible links between air pollution and diseases such as Alzheimer's.
And so if you can imagine, you have these different pathways that these small particles are getting into our bodies, and they're either staying in our lungs and causing inflammation, or they're going into our bloodstream and causing issues with our cardiovascular system. So if that is caused, by ambient air pollution, what are the impacts for somebody who might be cooking indoors for half the year over wood or charcoal stove, or during the rainy season or something like that? How does that impact them to an even greater extent?
Yeah, I think they're exposed in general to much higher levels of pollution than they would be outdoors. So we see these same types of health effects with outdoor air pollution as well. But we're mostly concerned for household air pollution for individuals who might have previous or underlying health conditions.
Mhm.
So with the respiratory diseases, if someone, an adult or a child has something like asthma already, being exposed to high levels of pollution from cooking indoors is definitely going to exacerbate that asthma. If someone has had
Sure.
previous cardiac events, they're more likely to experience additional impacts or severe outcomes with high levels of pollution.
Hmm. And I'm assuming it's cumulative, right? Yet you might not see impacts until 10, 20,
Yeah.
30 years down the road of consistently being exposed. Is that correct?
Yeah, I think this is one of the tricky parts for the health research side. So the respiratory, we can see, much shorter time periods from
Hmm.
exposure to, asthma, right? We can, after 30 minutes or an hour of an exposure, you'll see those impacts on the respiratory system.
Sure.
But the cardiovascular events, it's definitely more challenging just because you often need, years of exposure to see a cardiac event occur.
Hmm.
But one of the other things that we can see shorter time frames from exposure to disease, and that researchers are looking at is implications for pregnant women and also small children. So pregnancy, right, is a 9-month time period. So that's relatively short when we're thinking about what might happen during exposure to household air pollution and the end of a pregnancy. And so researchers are using that time frame and the vulnerable population of pregnant women, right? We want to
Hmm.
keep babies healthy, and we've seen that household air pollution is associated with preterm and low birth weight babies
Hmm.
among pregnant women who are exposed to high levels of air pollution. So we've seen short-term effects within 9 months, but it is really difficult to capture that cardiovascular disease outcome, especially in the research setting.
Sure. Now, you talked about certain people or groups that are more at risk, including pregnant women and young children. Are there other groups or demographics that are higher risk than others?
Yeah, we tend to think of those pregnant women, children, those with like underlying chronic diseases, those with asthma, also elderly, just given other things that they might be facing, and because they are more at risk for cardiovascular disease. That's another big sort of at risk group. Would be sort of the elderly population.
Yeah. And, it seems like it's almost impossible to get away from some of the damage, at least, that is caused through particulate matter. But are there ways to mitigate the damage from that or preventative actions you can take?
Yeah, I think there definitely are, and there are ways to do this on an individual basis. So, if you're cooking with a polluting fuel, um, some of the best ways to mitigate the damages from the air pollution are simply increasing ventilation. So, for households that are cooking inside, for us, if we're cooking inside, right, we might turn on a fan or just increase ventilation. So, open windows,
Mhm.
open doors, and this drastically reduces the indoor levels of pollution that we might be breathing in.
Sure.
So, this cooking outside that lots of people do around the world is actually a great option to reduce their personal risk from
Mhm.
the air pollution. Um, and, the thing that I think we're most interested in from the policy perspective is okay, there's so much we can do on an individual basis. I can increase ventilation. But
Mhm.
unless I'm really changing my stove or my fuel, it's going to continue to produce this pollution.
Mhm.
And so, one of the things we advocate then for is the changing to more efficient and cleaner cook stoves, and less polluting fuels for individuals.
Hmm. Yeah, and that's a good point because a lot of the cooking I've seen around the world where it is done indoors, there really isn't any ventilation. Maybe a small window, but certainly not anything significant enough to really impact uh, a health outcome. And yeah, to your point, it's really important that there are some larger voices that are helping advocate for clean fuel options and opening up access. You
Mhm.
talked about how rural areas more often are using firewood and fuels like this because they're accessible. They don't
Mhm.
have access necessarily to an electric grid or to LPG or to a bioethanol stove, and so they're using what's close by. And so when you can help work with government or other groups to make fuels more accessible and provide clean options, that gives people a legitimate alternative.
Hmm. Yeah. And I think it's important because as individuals, right, we are bound by the constraints that we have. And if we don't have access or we can't afford it, we need support from our community and from our government
Hmm.
to help that process.
Yeah, definitely. So you've done some research work specific to bioethanol cook stoves. You've talked about this, Honduras, Ethiopia. I know you've done some other work in other countries as well. Can you just share a little bit about maybe a specific project you really enjoyed or some specific research that you have worked on in the past 10 years?
Yeah. So I have done, as I mentioned, work in Ethiopia and Honduras. Um, and, bioethanol has not always been at the forefront of clean cooking. I think the predominant fuel is liquid petroleum gas or LPG. And so I've been involved in research studies that have looked at transitioning households to improved biomass or to LPG. And the thing I love about doing household air pollution research is the ability to to go and visit local households and communities. And what we do as epidemiologists is we design studies that ultimately compare some sort of improved or cleaner burning fuel and stove combination to a traditional option. And sometimes the best way to do this is through randomization, which creates a more robust comparison between the two groups. And then we get to monitor either kitchen levels of these pollution, particulate matter, or carbon monoxide, or personal exposure to this.
Mm.
And we tend to do this over a 24 or 48-hour period. And then we relate this exposure data to health outcomes. These could be self-reported health outcomes, but we are sort of advancing our capabilities and looking at lung function, birth outcomes, which I mentioned, or
Hmm.
biomarkers of future cardiovascular disease risk. Like we can measure these cytokines in blood that indicate future cardiovascular risk and sort of associate exposure with those health outcomes. So I haven't actually been involved with like an epidemiological study of bioethanol stoves because it hasn't been as readily available for large studies to take on. There have been other researchers who have done this and actually seen improved birth outcomes with bioethanol stoves. But I have done this with other types of stoves, LPG and improved firewood. And of course, we're actively seeking ways to get involved and do research around bioethanol cook stoves and health.
Hmm.
What I've done more in the space with bioethanol stoves specifically is evaluating other projects and thinking about the uptake and acceptance of bioethanol by end users and households. So I'm a part of a much larger team of researchers, including epidemiologists and economists who are evaluating the implementation of this market enabling framework for bioethanol in Dar es Salaam, Tanzania.
Hmm.
And that study is a UNIDO project funded by the Global Environment Facility, looking to increase supply chain, to increase access to consumers within the city, the urban environment, looking at results-based financing. So a little bit more on the finance side and not on the health side, but they go hand in hand because unless people are willing to use these stoves and afford them and utilize them on a daily basis, we don't think we're going to see the health benefits. So this project is sort of evaluating the rollout of this market-based approach to ethanol stoves and trying to understand what factors are driving uptake, both internal and external to the project, and hoping to share those findings with other projects or other governments looking to take this step to promote bioethanol as a household fuel.
Hmm. Right, because people can't really care about the health impact of it if one, it's not even available, or two, it's not affordable. And so I think it's really important to be looking at that supply chain build up, to be looking at the different support that governments can provide, and that kind of leads me to the topic I wanted to ask about was, okay, research, it's great. You have this data set that you can work with and develop, conclusions off of or other studies from. But what relevance does it have in that practical development space? How can it be utilized there?
Yeah, I think that's a great point, and I think something that we're aware of in research. But yeah, I think I've been thinking about this a lot since the workshop in Mozambique, actually, and sort of the role of research, especially around health. But I think it's really important to have solid research on household air pollution as it relates to health. You know, and for other factors, right? We need to understand emissions of newer technologies and newer cook stoves. Like, how do they
Mhm.
perform in a lab? How do they perform in the real world setting? It's often
Definitely.
very different. And we need to have research that evaluates cooking behaviors, stove use, cooking preferences, price, accessibility from lots of different communities around the world, right? I
Hmm.
think the first thing policymakers and advocates of their communities will often mention is like, you know, my community is different and my community is unique, and that's right. And they want something that fits for their community and their population. And so
Exactly.
we need something that works for them. And so research can help us get to that point. From the health side, we really need to use, robust methods and study design that show that if we transition to a cleaner burning fuel and stove, we're reducing that exposure and we see health outcomes.
Hmm.
Studies like the implementation science project that I mentioned in Tanzania are also really important in providing reflection and guidance on what makes a project successful and what barriers there are to success.
Hmm.
So sharing those findings with other researchers and implementers creates, I think, this body of evidence that ultimately we hope can be used by um, international, national, and local policymakers when they want to create an enabling environment for clean fuels. And so we try to provide that platform and evidence for forward thinking and decision making.
Yeah, absolutely. It's, I think, very helpful if you're going to have a serious conversation, even around economics, to be able to have a foundation for why it makes sense to move forward with a certain fuel or technology type based on some of the research that's been done, and be able to kind of have a case study that
Mhm.
will support the the advances that you want to make. And I think that makes the conversation more relevant to policymakers.
Yeah, and I'll just mention, I think, you know, often when we think about like global, very large global health interventions, um, I think what we need to keep in mind, right, is that they don't, one intervention on a given health topic or a given issue is not by itself going to make a large difference, right?
Mhm.
I really think that um, combining the health effects with the environmental concerns, with economics and agriculture, right? We can, if
Mhm.
we look at the big picture and see all of the benefits of, transitioning to cleaner fuels, I think that makes it a clearer picture. It has much larger advantages, and potentially, right, is something that folks would want to fund and put money into. Um,
Exactly.
so being more holistic, I think, is definitely something I advocate for.
Yeah, that's an excellent point. When we talk about the role that bioethanol can play, we talk about developing an economy with it. And that's because you have that backbone of agriculture where it starts, and you have the manufacturing and production that comes along with it. You have marketing and sales, and then you have these adjacent sector benefits with health and environmental protection and climate. And so it is very important to look at the entire picture and not just pigeonhole on changing somebody's cooking practice,
Mhm.
because it has a lot of other impacts.
Yeah.
So, clean cooking is starting to gain more traction in the global conversation. We've seen that at COP and other global conferences where cooking is starting to be looked at more seriously as a way to impact emissions and improve health outcomes in different countries. So, I'm just curious what you think it's going to take to really have a serious impact. And, clean cooking is seriously underfunded right now. It still doesn't have the traction that it needs to really scale. And so, what's something that you think would have a serious impact in helping it grow quickly in regard to the cooking space?
Yeah, I think that's a great question. And if I knew the full answer, I'd probably be in a different job. But again, I think it's making sure that clean cooking in whatever form is at the forefront of conversations, and that it is realized as right this economic possibility. Governments are looking from the health side to meet sustainable development goals from
Mhm.
health and for other things, right? And and having people understand where this fits in that bigger picture, and that I think it really could have a large ripple effect on all sectors of the community and of the government and countries, right? So I think, from my perspective, the health component, I think is very clear that, for some people and some governments, right, health is a priority, while others have other issues that they'd rather address first, whether that's
Mhm.
environmental conservation, whether that's agriculture. Um, you know, Everyone has different priorities. But I think if we can take this team-based approach, um, in my mind, if someone wants to implement a clean cooking project, right, and health is not the leading factor, that's fine. It doesn't
Mhm.
matter, I think, because we're going to see the health benefits no matter the reason
Regardless.
for
Mhm.
promoting this. So I think it's great that clean cooking is entering into sort of adjacent fields, not just from the health perspective, but from all these other creative avenues, and really seeing where it fits within policymakers' interests and
Mhm.
putting it on the table.
Yeah, definitely. Well, I am going to wrap up soon, but I'm just curious if you have a personal story or experience you've had with cooking in, one of your forays abroad that made the topic of clean fuels more personal for you.
Yeah, I saw this question on the prompt and I was like, that's a good question. You know, I think cooking, which I had never maybe put into words before, but my dad loves to cook, like is a great cook. And when you go home on holidays and have home cooked meals, like it's just one of the best feelings, right? It provides memories of of
Hmm.
of great times. And I think that's one of the most fantastic things about working in the field of research and actually being on the ground and helping households is that people are so welcoming and hospitable, and really end up, in the Honduras study, for example, we would visit them, every 6 months, and so we would see them, and they started treating us like their own family. And
Yeah.
you're around during cooking meals, you're taking measurements, you're monitoring their cooking, and
Hmm.
so they're cooking for you, and they're
Yeah.
you know might not have a lot of resources, might not have a lot of food, but more often than not, I mean, we had families just offering us snacks, but making some pretty intricate meals, with ingredients that were costly. And it's just
Hmm.
experiencing that generosity from families and the openness to share food in different cultures that I think is one of the best parts about working in this field.
Hmm. Oh, thanks for sharing that.
Yeah.
And then, since we are still talking about cooking, what's your favorite food to cook and why? Did you follow in your dad's footsteps of becoming an excellent chef?
I've attempted. I do like to cook. I have two small kids, so I'll say that I cook way less than I used to.
Sure.
But I attempt when they give me space and time to cook. I love to eat and make anything spicy,
Mm,
um, curry, stews. My mother-in-law from Nigeria has attempted to teach me lots of recipes, so I am always open to try new food and new recipes. So if it's got spice in it, I'm willing to try it out.
awesome. Well, I really appreciate the conversation today. And I think you help paint a really clear picture of how health is intimately tied to cooking practices and what kind of impact that has around the world. It's astonishing how large that number of fatalities is every year just from how somebody cooks their food. And so, we really appreciate you coming in, sharing about that, making it accessible for us to understand, and also realizing why we need to be proactive in helping transition people out of harmful fuels.
Yeah. Thanks for having me, and I'm excited to have this platform to share ideas and hopefully make some future waves.
Yeah. And hopefully we can have you back again, maybe after your next research project.
Great. Yeah, that'd be great.
Thanks so much for listening. We are passionate about opening access to household energy around the world that also lead to reduced emissions, improved health outcomes, environmental protection, greater purchasing power, gender equity, and so much more. We would be grateful if you found this information valuable and pass it along to friends, family, colleagues, your mailman, your grocer, anyone you know, and find some way to get involved. Don't forget to follow us on our social accounts on LinkedIn and Twitter. Check out our website at pivotcleanenergy.org. And of course, follow us on Spotify or wherever you get your podcasts so you can catch us when the next episode drops.